In the North, ambulance technology was pioneered by Major Jonathan Letterman, who in 1862 set up the first Union Ambulance Corps committed to battlefield evacuation. The Letterman system included training soldiers to become dedicated ambulance drivers and stretcher bearers. Although the medical supplies ambulances were stocked with were rudimentary, the ability to quickly get injured men off the battlefield and into field hospitals was revolutionary. Letterman later became known as the father of modern battlefield medicine. Up until the Civil War, nurses weren't established as an important part of warfare. When the war began, there were no organizations of trained nurses in the United States, but by its end, between 5,000 and 10,000 people had taken roles as nurses on both sides. They could work as trained professionals giving direct medical care, as hospital administrators, or simply as attendants offering comfort. They assisted surgeons and tended to the sanitary, social, and psychological needs of wounded servicemen. Many Civil War nurses had impressive legacies. Clara Barton founded the American Red Cross, and Annie Etheridge was buried as a veteran for her courage in riding out onto the battlefield to treat injured men.
How's it look?
Not looking good, sugar. It looks like the infection's spreading to the rest of your arm, and I fear that if we don't amputate in the next few hours, you could lose your life.
Three out of every 4 surgeries performed during the Civil War were amputations. Compared with the amputations done today, these were downright brutal. Anesthetic was introduced in the United States during the 1840s, meaning the science was still in its infancy. One of the most effective and commonly used anesthetics during the Civil War was chloroform. Today, we know that chloroform is highly dangerous, but in the field hospitals of the Civil War, it was the most reliable method of knocking out a patient. Compared with the North, the South had much more rudimentary medical technology. Although some supplies, including chloroform, were often smuggled in from the North, countless operations were performed without the use of any anesthetic. In these cases, many surgeons gave patients whiskey in an attempt to dull pain as much as possible. Then, the patient was held down, usually by a team of aides, while the surgeon sawed through his arm or leg as fast as he could. A skilled surgeon could amputate a limb in 10 minutes or less. Afterwards, limbs were thrown onto piles which could reach 4 to 5 feet high.
Alright, I'm about to amputate your arm. I'm going to go as quickly as I can in order to minimize the pain. Here, drink some of this whiskey. And bite down on this belt.
Even after a patient's arm or leg was amputated, survival was far from guaranteed. Although the survival rate of amputees was generally about 75%, in reality this number could be much lower, especially in the South. For an amputation like the one shown, performed by Confederate surgeons, the survival rate for amputees was just 30%. Assuming the patient didn't die of blood loss or shock during the amputation itself, it was not uncommon for serious infections to set in afterwards due to the septic conditions most amputations were performed under. Thousands of amputees eventually developed sepsis or gangrene, about 45% of whom died as a result.